is there any law with regard to how the ethical considerations of AI in the health sector?
So I think as this is quite a new field, people are looking at kind of building guidelines into how these technologies can be brought in. They're currently going through existing regulatory pathways, but I think that in the future there will be specific regulatory pathways for AI technologies. And there is a new system in the UK where you can apply to get AI approved as a medical device. So these new systems are coming into place, but this is fairly early days for this.
Hello and welcome to yet another MBA Diary session. Today we have a very interesting personality to talk to us about a very interesting and upcoming topic, AI implications in the health sector. To introduce our speaker for this evening, I'd like to welcome Dr. Rohan Babakorala, the pioneer behind the MBA Diary series, to officially introduce him. Doctor, over to you.
Thank you very much, Ruth. And actually, it's an absolute honor for us to have a very eminent Sri Lankan origin personality who actually needs no introduction, because he's a person who actually was challenging the likes of Elon Musk, who on this whole area of facial recognition, and very interesting, which he will actually share a lot about. He's a pioneer reconstruction surgeon utilizing cutting-edge AI technology to plan and perform facial reconstruction procedures using brain-computer interface. He specializes in complex cases involving trauma, cancer reconstruction, and congenital defects of the face, utilizing 3D planning software and AI algorithms. He is renowned for his ability to restore form, function for patients with severe facial disfigurements. He's the CEO of machine learning startup Cogitat. His quest is to integrate brain-computer interface technology into the operating room. This technology can potentially enable real-time feedback to improve surgical precision and patient outcomes. Based at the Royal Free Hospital in London, he's an associate professor at the University of College of London. His purpose to life is to help transform the lives through reconstruction surgery, innovative neurotechnology at the intersection of science and entrepreneurship. Ladies and gentlemen, the surgeon, entrepreneur, associate professor, University of College of London, Chief Executive Officer of Cogitat, Dr. Allan Ponniah. Allan, over to you.
Thank you very much, Rahantha, and thank you for inviting me to talk. Pleasure to be here. I'll just load up my presentation. Okay, can you see it clearly?
Perfect, Allan. Thank you very much.
Great. So I'm going to be talking about the AI implications in the healthcare sector, and I'm going to begin with looking at the scope of what I'm going to talk about. What is artificial intelligence? How it can be used in the healthcare sector? What are the barriers to its use? And examples of how I use it. So 94 years ago, the founder of the Mayo Clinic, Dr. William J. Mayo, said, "The idea of medicine is to eliminate the need of a physician." And so I asked the question, can AI eliminate the need of a physician and therefore complete the circle? So what is artificial intelligence? AI is the simulation of human intelligence. It is where machines are programmed to think and act like human beings. And there are different aspects of this. One example would be machine learning and pattern recognition, where a machine can recognize a face similar to how a human can recognize a face. Here you can see some software that I built for facial recognition that, even with a lot of disguises, the software can still recognize this as being me. So therefore, the technology has gone beyond where a machine can recognize similar to a human, in that now it can recognize to a higher level than a human. For example, the recognition software can detect emotions, and it can also detect large numbers of faces and recognize them simultaneously, which goes beyond the capability of human beings. Now, I want to talk a little bit about robotics. This is a demonstration of the best robots in their field in 2015. These robots are unable to carry out simple tasks that human beings can do, such as standing up straight. They can't walk properly. And this is the best that robotics had to offer in 2015. As you can see, there was a long way to go before they can perform functions like a human being. If you fast forward that to the present day, not many years have gone past, but the advances in robotic technology have advanced so far that now robots are able to do things beyond the capability of many humans. They can perform very accurate, coordinated activities. There's no instability, as you saw before. Not only can they walk, but they can run. And the dramatic advancement that has happened in the last few years is very clear to see when robots can perform coordinated activities with each other that many human beings find difficult to do. So how can this technology be applied to healthcare? There are a number of ways in which AI can improve diagnosis, and it can improve precision medicine, where medicine is very specific to an individual, taking into account every detail about that individual and using the data from large demographic groups to identify how to precisely treat a specific individual. You may have heard of large language models such as ChatGPT, which can be used to improve diagnosis and improve communication between doctor and patient, and improve communication between doctors. And of course, robotic surgery is something that is now starting to take off in a big way. So looking at diagnosis, radiology, where a computer can see an image and use its pattern recognition to diagnose if there's an abnormality in that image, is something where the technology now is quite mature. This technology has been advancing quite a lot from these static images. Therefore, with things like face recognition and image recognition, the technology is very mature, and therefore it's coming to the point now where computers are able to make diagnosis from scans that are approaching the level of human beings and beyond. What is also happening is diagnosis in pathology. So the pathologists typically look at slides under a microscope, and these are now for some time being digitized. And with the digitized slides, it's possible to train a machine to be able to recognize abnormalities such as cancer and other diagnoses. And therefore, within time, these, like the face recognition, will become at a level that's more accurate than a human diagnosis. So what are the barriers to adoption for AI within the healthcare system? One of the key issues is data. Data is something that is very sensitive in terms of patient-sensitive data, where consent needs to be given for that data to be used. And therefore, it's difficult to get the right data in order to analyze it, in order to create the new technologies that can help future patients. One of the other problems is costs. The costs to the hospital can be a lot in terms of some of the newer technologies. And so a solution to this that I'm exploring is to have a data sharing agreement with the hospital and the technology company. Because if the hospital has the value of the data and the technology company has the value of the AI technology, putting them together, there should be a data sharing and a revenue sharing agreement, which then reduces the cost for the hospital, but also allows the hospital to use the latest technology to treat its patients. There are a lot of ethical concerns around AI, because if the machine gets the diagnosis wrong, then who's to blame? So it is very important to understand that these need to undergo very careful regulation to ensure that no mistakes are made in the treatment of patients. And there is, of course, resistance from doctors, because as you can see from the previous example, the radiology and the pathology can be done by a machine, and therefore doctors who perform these diagnoses are worried that this technology may take over their jobs. So now I'm going to talk a little about how I use AI in my practice. As I'm a facial reconstructive surgeon, I'll give you an example of how I use it in facial reconstruction with planning surgery, during the surgery, and after the surgery. So here's an example of a patient who, when they were a child, were born without a nose. And they had a number of reconstructive procedures in the past, which created a form of a nose, but a lot of that had collapsed and they hadn't had any further treatment, and came to me because they weren't able to breathe properly through their nose as the nostrils started to be closing. And so we decided that we would try and make a new nose for her. And in order to understand what kind of a nose would fit into her face shape, I used some technology that I had created previously. So previously, I was exploring what a normal face is. A normal face seems like a very simple concept, but if you look into it, everybody has a different face shape, but everybody is considered as a normal face. And it is important to understand what that means in terms of actual shapes. So I collected a lot of data in the past. I collected 12,000 faces using a high-resolution 3D camera. And within this 12,000 population, we managed to capture all age groups, all ethnicities, and both sexes in order to cover the whole range of the human population, in order to understand what a normal face is. And this was reported in Science magazine when we created the most accurate digital model of the human face. How does AI help with this? What we also used was a concept called generative adversarial networks. And what this means in essence is that there are two brains, two artificial brains that are fighting with each other. One brain generates an image of a face and asks the other brain, is this normal? And the other brain looks at the face and makes an assessment of if it is normal, and if it isn't normal, what is wrong with it? And this keeps going round in a loop until it achieves a normal face. Here you can see from our data, we can generate faces from all ethnicities, all backgrounds. And these faces are faces of people who don't exist, but are generated by the computer model. So it understands the structure of faces and how they're put together. And this can be applied to reconstructive surgery. When people are missing parts of their face, we can understand the best shape that we need to build into that structure. So for example, using this technology, you can see here, we created a version of her face with a nose. And this is a kind of nose that fits in very well with her face shape. As you can see from the side, there's quite a lot of tissue that is missing and needs to be created for her reconstruction. And in order to translate this from a virtual image into an actual nose takes a number of steps, because we have to bring in living tissue from different parts of her body to build a nose. And the nose has to be built in 3 layers: the internal lining, the structure holding the structure in place, and the outer surface. In order to plan the surgery, we can use 3D printing. Here you can see that a 3D print of the face in silicon was used. And this initially builds the first structure, putting all those components together. Then using the software again, we're able to refine the nose according to the shape that was planned. And we can use the silicon in the operative theatre in order to plan for the surgery. And here you can see before and after the surgery, she begins without a nose, and at the end of it, she has a nose. And she told me that when she woke up from her first surgery, it felt like someone had opened a window in her face, because she was finally able to breathe properly through her nose. There are some finer refinements that are required, so I plan to do some further surgery to take what she has now towards our original plan. So other ways in which we can use AI, because I treat a lot of patients with skin cancer, I'm creating an app that can diagnose it from a picture alone. And this, again, is using technology that already exists. Using natural language processing, we can communicate complex medical ideas to patients through patient leaflets, patient chatbots, and our communication between doctors can be improved. And we can also use it to make medical decisions. Since the beginning of time, man has been trying to communicate with his environment, and it began with writing on the wall, then writing on paper, then the typewriter, the printed word, the internet. And now we're meeting a new frontier where we can connect the brain directly to our environment. And this is some technology that I'm very interested in, because it is using AI in a way that's much more complex than it has been used before. So AI being used to analyze images is different to AI being used to analyze the brain. The brain is not like a static image. It's a constantly moving target. The state is moving all the time. And therefore, we created AI filters to filter out all of this kind of change in the brain to focus on the signal. And we entered a competition where 110 EEG labs around the world, including the US Army, entered, and we came #1 and beat everyone in terms of our accuracy of decoding the signals. So the vision I have with this is to build the core brainwave decoding technology for all EEG devices. And in the future, devices will be much simpler. This is a device that currently exists, but the accuracy isn't quite there yet. So as hardware improves, there will be devices that are very easy to wear that can read your brainwaves and connect people to the environment. If you look into YouTube and Google the word Cogitat, the name of my company, you will find this mind control gaming experience where we invited members of the public to play games just by thinking. So just by thinking, they were able to control these games. And we've demoed this technology to the media so that people can see that this is something that is at its early stages, but it does work, and you can control things just by thinking about them. I'm also very keen to bring this into the medical world, and there are a number of aspects which we're exploring at the moment. One of the main aspects is stroke rehabilitation. Here, a patient can't move their limb properly, but if they imagine moving their limb and this drives a virtual hand in a game, they're then able to begin their rehabilitation in a way that they haven't been able to before. And I'm bringing this into clinical trials next year. We can also use the EEG technology to measure the effects of any drugs on the brain. So this can be used to improve drugs in Parkinson's disease, dementia, mental health, and epilepsy. We can also monitor the brain during sleep and during anesthetics, so that during the anesthesia, we can keep the brain as safe as possible. And I also want to use this to train the next generation of surgeons. As you can see, these are the areas we're focusing on: stroke rehabilitation, dementia, mental health, sleep monitoring, and surgical training. Regarding surgical training and robotics, we can use the EEG to read brainwaves, which will understand when an individual is about to make an error. It will also be able to assess lapses in attention, and it will be able to understand if the individual finds the task too taxing, and also whenever they're about to create an error. They'll be able to measure their fatigue levels and optimize their training so that they can always perform within the flow state. So, in summary, I have talked about what artificial intelligence is, how it can be used in the health sector, what the barriers are currently to adoption, and examples of how I use it. Any questions?
Thank you, Alan. I mean, that was fantastic. Ladies and gentlemen, Dr. Allan Ponniah, one of the top Sri Lankan origins, who's doing fantastic in England. And a whole heap of questions are coming in. I'm going to take one by one. The first question is there any law with regard to how the ethical considerations of AI in the health sector?
So I think, as this is quite a new field, people are looking at kind of building guidelines into how these technologies can be brought in. They're currently going through existing regulatory pathways, but I think that in the future there will be specific regulatory pathways for AI technologies. And there is a new system in the UK where you can apply to get AI approved as a medical device. So these new systems are coming into place, but this is fairly early days for this.
How is the sustainability of using AI on patients, Dr. Allan?
I mean, it again depends on which application we're talking about. So, as I said, there are many applications that are already the technology is quite mature, such as image diagnosis and pathology diagnosis. So I think for these aspects, because we're using existing algorithms to kind of measure shape changes in different pathologies, I think those aspects are very sustainable. It's just as we develop more kind of newer cutting edge technologies, then it requires more resources. So I think that there's a spectrum.
So a very interesting question is coming from Rachel, and she's saying, how long will it take for the kind of uh, technology solutions that are given right now in the UK to come down to a country like Sri Lanka?
So again, it's difficult to know. I mean, I guess it all depends on cost. And as I said, that I think it's important that companies with technology partner with hospitals who have data, and therefore, if hospitals in Sri Lanka, partner with technology companies with some kind of data sharing and revenue sharing model, then the companies will benefit by creating the technology from the data, and the hospitals will benefit from using the technology. So these types of models need to be introduced in order to accelerate the adoption, because medical data is extremely valuable and hospitals are sitting on this data, and there should be a way that a hospital is able to monetize this data for the benefit of patients. And therefore, if there are these connections made between hospitals and AI companies, then there could be a win-win solution.
I mean, there's a question coming from Parami. She's actually based in the UAE and studying for the masters. And the question she has is that uh, what happens if criminals want to change their whole configuration, and they would use AI and the technology that you shared? How does that work in a typical country?
But again, it's all down to regulation. I think that it's important that the regulatory bodies understand the technology and are able to put in the right regulations to prevent criminal activity. And therefore, certainly in the UK, I speak with the government about about the capabilities of the technology, and regulation has to follow accordingly. In some of the technology, people are very frightened because we can read brainwaves, so they believe that it's possible to read someone's inner thoughts. This is not possible. So therefore, I think regulatory bodies have to focus on regulating what is possible, and that is only by communicating with companies who are building the technology.
Helen, I was just reading that article of the facial recognition and how correct use could improve everything from crime to healthcare.
Yeah.
When you talked about this whole concept of where you have this, where you can connect a brain to the internet, and I, I think it was in fact you challenged Elon Musk on that whole platform. What was that whole story about, and
Yeah.
what would be?
So essentially, Elon Musk has built a company called Neuralink, which is beginning clinical trials where it requires a operation to take part of your skull away and put an implant onto the surface of your brain. And using that, you can then connect your brain into a computer to do the kind of things that I was discussing. But with the technology that I'm building, you don't need an operation. You just put a headset on your head. And the reason why people have gone into the brain is because they haven't been able to get the accuracy with the headset on the outside. And this is the technology that I've been building to try and improve that accuracy, so you don't need to have an implant placed inside your brain.
Does it mean, Alan, that in a court case, you can check to see the accuracy of data that witnesses give?
Again, this is a tricky part of the technology. I think it'll take a very long time before we can, verify exact kind of what a witness is saying. So as I was saying, it can't kind of read your inner thoughts, But at the moment, it can read your intentions. So if you intend to move your arm, it can read that. If you intend to walk in this direction, it can read that. But if you are trying to be evasive, it's going to take some time before those things can be read.
What is the implication, Alan, of your technology to sports? Because we see that man is now, for instance, was at one time doing 100 meters at 10 seconds, and then it became 9 seconds, and you have a person who has done a 9.7 seconds, and 8.9. So do you feel that there are a lot of AI implications to sports, Dr. Allan?
Yeah, so I think at the moment, as I said, I'm building technology to rehabilitate people from stroke. So that's taking somebody who can't really move their hand to a place where they can fully functionally move their hand. But that's not to say that you can then take them from where they can fully functionally move their hand to something much better, like playing cricket or playing tennis. So you could train the mind-body connection much better using this technology.
So, is there any progress that one can make?
I think so. And I think once I've demonstrated rehabilitation, then I will take it to the next level of demonstrating training, improving training in sports.
So, Dr. Allan, that would be a amazing market, no? Because right now there is some degree of where you can check the speed of a muscle, and then you can analyze and see whether a person fits into short distance versus a long distance, which is what athletes in Jamaica does. And there's an American team right now who is studying that. There's one of my colleagues in Harvard who said that the current study has been done as to how Jamaican athletes far supersede American athletes. So, do you feel that AI can have that breakthrough as to how the Jamaican athletes outperform American athletes? I mean, is that possible?
I mean, AI is about pattern recognition. So if there's a pattern to find that distinguishes the two, AI can find it.
So I'm just taking a hypothetical example. I'm sure it might. So if two people are going to get married, can AI tell you the chances that they might think together?
I think even AI may struggle with this.
That's a good one. So there's a very interesting question coming from one of our students who actually is based in the African continent, and she's asking, the first time that we have seen amazing Sri Lankan origin doing wonders in this area of technology and going ahead. And she's asking, what next, Dr. Allan Ponniah?
So I mean, next is to continue to build this technology within healthcare and bring it to as many patients as I can. So that may involve bringing it into countries outside the UK.
Alan, does it mean that, don't you think that you will have more material in a country like Sri Lanka?
I think so. I think that's exactly. And so I think that setting up strategic kind of links with countries where we want to develop the technology and also deliver the technology is very important. And where there are more countries involved, there's more data and more diverse populations involved. Therefore, we learn more, about the human condition.
Here, the Anthony, she's based out of Brisbane. She's asking, she's studying for a PhD there, to AI and the link to healthcare.
Sorry, I missed that question, Ranta.
This was from one of our lecturers in Asia Pacific Introductory Technology, Alan, and she's actually doing a doctorate from Brisbane, Dimantini, and she's asking a question. She's saying, is there another country in your mind who is slightly ahead of the curve when it comes to AI and health sector, where lessons can be picked up and maybe redefined?
Yeah, I mean, Israel are doing a lot of work in this sector. They have kind of AI startup ecosystem within a lot of hospitals. I mean, I had planned a trip there, but maybe delayed or somewhat. But I think they're definitely countries that we can learn from.
One last question, Alan. Do you feel that AI will one day take over the functions of a human being?
I mean, I think this is a difficult question because it is difficult to define what a human being is. Everyone has a different definition. Does it involve a soul? Does it involve, these different kind of aspects in terms of what human being can function as, in terms of specific functions that a human being can do? The AI can take over these specific functions. However, whether it can take over what a human being as a whole can do, the capacity to love, the capacity to do all of these kind of things, it's very difficult to judge.
And there are some questions that have come on the chat, and it says, is there any type of benefit that will prove to be useful for drug rehabilitation, and people who have been abused on drugs, and how they can be rehabilitated using AI?
Yeah, so there are, as I say, brain state measurements. So you can measure when somebody is depressed. You can measure when somebody is firing their reward system at the wrong times. So these things can be measured, and if that's combined with the right mental health care, then it can accelerate, I think, the process of recovery.
Viranga, actually, he's on the MBA program right now. He says, have you done any experiments of malfunctionings and any solution for same?
I don't fully understand the question.
It says experiments of malfunctioning. And I reckon he must be wondering as to how machines are operated and whether any solutions can be developed using AI.
Yeah, I haven't looked into that, I'm afraid.
It says, can AI robots effectively detect cancer through scans?
Can AI?
Samir is also an MBA student. Can AI robots effectively detect cancer through external scans?
Yeah. So again, it depends on the cancer. There are studies that have been published showing that AI looking at scans of women with breast cancer have been able to pick up the cancer before it's even happened, when they've been using the machine to look back at previous scans. So in that case, yes.
In terms of delivering technology and handling it, do you think that the current students in Sri Lanka are given the opportunity to study such complex concepts?
I'm not sure what the curriculum currently is, but I think with the advent of the internet, there's a lot of material out there that everyone has access to and should make the most of it.
Thank you very much, Dr. Allan Ponniah. I've taken actually 6 minutes more than what I had booked time for you. The surgeon and entrepreneur, associate professor, University of College of London, CEO of Cogitat. Ladies and gentlemen, Dr. Allan Ponniah, thank you so much. Ruth, over to you.
Thank you very much.
Thank you, Doctor. And thank you so much, Dr. Allan. I understand AI and especially its implications in the health sector is not a topic you can fully cover in about 20 minutes. I understand you have done your utmost in sharing the most amount of knowledge you can with us and your experience and the work you've done. So this is definitely not something our students or anybody viewing this session could read easily, especially the experience you have gained through the work you've done. And we are immensely proud of the fact that you are of Sri Lankan origins and doing great things on foreign land. So thank you so much for accepting and coming on our platform and sharing with us all that you have and the experience, and for answering all the questions our students have been sending your way.
It's been a
There's no
pleasure.
words, not enough words to say how great it is and how privileged we feel for having you on board. With this, thank you once again
Thank
for
you.
accepting this invitation. So with this, we have reached the end of this MBA Diary session. And before we close, I would like to remind our industry partners who've joined in that our curriculum has a well-structured internship program, and we would like, if you do have any openings for internships or even on a permanent cadre, to send it our way, and we will do the necessary. And also for any viewers on Facebook, we've got some newly introduced MSc programs. So do check those out on our website, on our Facebook page. Do call in or even walk in for more details. Ladies and gentlemen, students, industry partners, to wrap up, I would like to thank our IT team for the technical support extended, without whose support, of course, we cannot smoothly run this session. Right? So till we meet again at our next MBA Diary session, do take care from wherever you're joining in. Have a good day, a good afternoon, and a good evening.